everyone. Dr. Oji here from MP Skills Made Easy Workshops. Today we're going to talk about difficult patient encounters. This is a topic I believe that advanced practice providers, nurse practitioners, and everyone honestly in the healthcare field will relate to. So you probably have had a patient encounter that stayed with you long after your shift ended. It could be that the patient refused treatment, it could be that they were angry, or simply just did not follow your plan of care or your recommendations. And so, of course, you take this home, lying in bed and trying to figure out what you could have done differently. Over the years, I've learned that protecting your peace, maintaining your compassion, and then, of course, understanding your role is crucial for you as a healthcare provider. So today, I will share some tips that I've learned over the years that would really help you to navigate the situations in your healthcare practice. What does a difficult patient really mean? First, let's talk about the word difficult. This is a phrase that I really am not a fan of, and I don't particularly like it. A difficult patient could be a patient who did not follow your plan of care, who was not just compliant, honestly, and someone that left your practice in anger and did not follow through with what you recommended. As providers, it's easy for us to focus on the behavior that we see in front of us. But what's harder is really trying to understand what's behind the behavior of a patient. Curiosity is better than judgment. So instead of asking yourself why the patient is behaving the way they are, a better question might be, what is the reason behind that action? What is the reason behind why the patient is behaving the way that they are? That simple shift can completely change the interaction. Challenging patients made me better at my job. Surprise? Most challenging encounters have actually made me a better provider. They've pushed me to know how to interact better with the patient, forced me to explain things a little differently, and of course, reminded me that healthcare is not one size fits all. Every patient processes information differently. Every encounter is different, and you have to recognize that. And this forces you as a clinician to customize care based on the patient in front of you. Every patient has different fears, different priorities, and different life experiences. Once we recognize this, we become better clinicians. So why do we take difficult encounters home? One question I hear often is, I can't stop thinking about this encounter when I get home. The most important reason that you want to think about is that we were not taught how to. We were taught diagnosis, pharmacology, and procedures, but very few of us were taught how to emotionally process a difficult patient encounter. So what happens? We take them personally, blame ourselves, or replay these difficult conversations. So wonder if we missed something, if we may have said something a little differently, or just going home feeling like we failed, and this should not be the case. Most providers don't know how to reframe this situation. So instead of asking, did I get the outcome that I wanted? A better question is, did I do the best that I could, or did I provide the best care that I could, given the situation and the circumstance in front of me? Let me tell you about a difficult encounter with a 75-year-old patient that I had. She was diagnosed with breast cancer, and at first this patient did not want any treatment. She declined treatment. I had wanted to send the patient to a breast oncologist, and she refused. At first, I had to explain to her what she really needed, which again was to go to see a breast oncologist for either chemotherapy or radiotherapy, but she declined. She declined because she felt she wanted just a natural outcome without any aggressive treatment options. This made me feel like, she should be treated. Like, again, that was a struggle for me. I wanted the patient to fight. I wanted the patient to get better. And I also would have loved if she lived. But at the end of the day, what I learned from this encounter is that the patient's voice matters. The patient's decision should be adhered to. And we should not force our will to the will of a patient. So at first, it was really hard for me because I thought about it that if this was my family member, right? And I would have loved for them to live. My role was really to advise the patient, but eventually step back and let her make her own decisions. So at the end of the day, this taught me that every patient's value is different, and their judgment is also different. Respecting the patient's wishes and their judgment of the situation is really the most important thing that you can do. So another story that I have about a difficult encounter would be a 15-year-old patient that had come in to see me for sexually transmitted infections. She had come in with her mom. And so the mom was naturally worried about the daughter. After I completed my assessment and questioned the patient about, what could be going on, I was able to find out that the patient was sexually assaulted. I found out very quickly that there's always a reason behind the behavior. I had to ask the mom to leave the room, so I wanted to provide privacy to the patient so that she was comfortable telling me about what was going on. So when the mom had left the room and I was alone with the girl, she actually just broke down crying, and she was able to confide in me. So when the mom had come back to the room, and of course it was now the three of us having the conversation, and just having a conversation with the mom about what had happened to the daughter. Of course, the daughter was the one that broke the news to the mom at first, but I was able to just step in to discuss with the mom. The mom, of course, broke down crying and was really emotional about the whole situation. But at the end of the day, we were able to get the girl some help that she needed. So how do you stay compassionate in healthcare? This is something I'm still working on myself. I like to think of myself as a gatekeeper. I can care about my patients, provide quality care, and do everything in my power to provide support, but I cannot carry those problems home. Another reality of healthcare is that patients could become verbally aggressive. Your most important and powerful tool will be to remain calm in these situations. Not matching their energy, not turning this into a battle. When necessary, don't hesitate to involve staff and security personnel. Your job is not to win an argument, but to provide safe and competent care for the patient. One phrase that I want every provider to avoid is "I told you so." Don't ever say that. It's going to infuriate the patient. So my final thoughts about the conversation we had today is really to lead with love. Show compassion to your patients. And just knowing that they may be having a bad day, is very possible that the patient is struggling financially. It's possible that they've had, a major life crisis. Or, again, whenever they hear bad news about a diagnosis, that would even further exacerbate an existing situation in their lives. So my advice to you would be just keep loving your patient, show compassion, make sure that you're doing your best and you're putting in your all to provide excellent care to your patients. But please do not take this home and leave it at work. Whatever happens at work should stay at work. Thank you so much for watching and listening. If this video was helpful for you, please like, subscribe, and share with another healthcare provider who you think will benefit from it.